Hi, everybody. I can only see one person. Anybody else there? Okay, so let me go to the first slide. So tonight, what I hope to do is have sometimes a little bit more interactive communication with you. And as Reeve mentioned, if you're going to work with animals and you're going to work with pet parents, you need to be able to communicate. And sadly, nowadays, people forget about the power of the voice. Tonight, we're going to deal with death, and we're going to deal with how we cope with this terrible subject every day, every other day in veterinary clinics, because as a veterinary surgeon or anybody working with animals, there's no question we deal with death regularly, probably a lot more than human nurses or human doctors, unless they're in a specific area of human nursing. But because animals have a much shorter life than a human, they get old much quicker and they die much quicker. And that's why they get sick quicker. And sometimes people will come in and say, I didn't know my dog was sick. And the dog is actually very near dying. So we're going to just talk about death tonight. And the objectives of my lecture is to try and help you understand the processes that result in death in veterinary clinics, how we respond to the death, both as the clients, the pet owners, and also the staff that are working with the animals. I'm going to describe and explain to you about the process called euthanasia, and we're going to try and understand what it's like to deal with an unexpected death. So some death that we weren't expecting. So I want you to take to this word here, written in blue in English, called euthanasia. And I would just like to ask you, does anybody know what this means?
And putting an animal to death when his or her disease is way too serious.
Yes, it can also be not just an animal, it can also be a human. And in many countries perform euthanasia on humans. And the human has obviously agreed to it and in many cases requested it. And it is the law of the country that euthanasia can be performed. It is illegal in Hong Kong. I just want to add that in. So euthanasia, it comes from the ancient Greek language where the Greeks came from many centuries ago. And euthanasia, other students on the class have told me things like, it's a sweet death. It's a pain-free death. It's a death that people feel happy about, not a death that people feel concerned about. So a sweet death and a quiet death is a meaning of the word euthanasia. And at the bottom of this first slide, can you see this little headstone? And this, in English, we would call it a marker, a grave stone. The grave, G-R-A-V-E, and I'm sorry, I don't have a whiteboard tonight. Reeve did offer me one, and I said I didn't think I needed it, but a grave is where a dead person gets buried into, or in many countries, a dead animal. So this picture at the bottom is a gravestone, a stone that's put on the grave to let everybody else know that there's some animal or some person underneath the stone. And there's 3 letters there, R-I-P. Anybody want to guess what that means?
Rest in peace.
Rest in peace, well done. And this is part of your English lesson on all these new words if you want to be a veterinary surgeon or a veterinary assistant. So it means rest in peace, correct, absolutely correct. Okay, so This is an old cutting out the South China Morning Post. It goes back to 2012. And to my knowledge, I don't think there has been a ban on paraquat in Hong Kong. I could be wrong, happy to be corrected. But paraquat is something that's used to kill things, usually weeds, things growing that we don't want to in a crop, say a crop of wheat or barley. But it can also have absolutely serious side effects on humans and animals. And this dog in the picture here, Gogo, went on a walk with the owner, this lady, and 15 minutes later, the dog was dead. And that's how quickly paraquat works. Over the last couple of months, there's been reported poisonings in Hong Kong, in Pok Fula, and more recently in Sai Kung, when dogs have gone on a walk, within 30 minutes,